body. Keep your posture upright. Bring it over to the starting position. Abduct your legs, squat, and lower, keeping your body up as best you can. Okay? That's your body mechanics. We'll demonstrate that to you. Next, strengthening exercises. I'm going to have you go through, and I'm going to say, show me D1 and D2 patterns for the upper extremities, and then show me D1, D2 pattern for the lower extremity. And basically all you're going to do is just show your patient passively how to do it. Okay? So, Ms. Cookie Dough, lay back down for me, please, on your back. Okay? We're going to start with, I'm going to have you scoot toward me, please, so that I don't have to bend over so far. Okay? We're going to start with our D1 flexion. You're going to squeeze my hand, bring your arm up and over towards, you'll be bringing your arm up, I'm just showing you passively now, up and over toward this shoulder. Then I'm going to have you open your hand up, and you're going to come back down and around over to the side. So, up and over, back, and rotating that hand down and back. Okay? You're just going to do it that quick. That's all I'm asking. Okay? The next one is going to be starting D2 flexion. You're going to be bringing your arm back this way. You're going to be coming up over your head this way, turning your thumb backwards like you're hitchhiking. And then you're going to squeeze my hand, and you're going to come back down to your left hip like that. That's all I need to see tomorrow. You know those patterns, okay? D1, flexion, right hip. You're going to come up and over and like so, okay? Then you're going to bring your leg, rotate your leg outward, and press it down over the side again this way, okay? That's D1. D2, you're going to be coming up, pushing out toward me. Now push your foot this way, and you'll be coming out like that, and then back down, like so. Okay? That's all I'm going to ask you to do. Show me the patterns quickly. You
said you wanted us to put them through passively first.
Put them through passively first. In other words, you're just going to do what I just did. You're just going to take them, because I was just guiding him right now, you know, or guiding him up into this. I'm bringing him down like this. So he knows, and you might have to do with a real patient, you might have to do that several times before they get it, okay? And that makes it easier than when you actually start applying resistance. It's not so hard for them. But again, your tactile cues will kind of guide them in what you want them to do, okay? So you're just going to demonstrate that you know those patterns. That's it. No big deal. Okay, what's next? Where'd my paper go? Okay, after that, we're going to go through, I want you to explain to me, Ms. Cookie Dough, what neutral spine is. So I'm going to just ask you, tell me what neutral spine is. If you were meeting a patient for the first time, please explain to your patient what neutral spine is. So I'm going to go through a quick and dirty explanation of our spines have curves. Those curves are designed there to protect our back and to give us the most efficient strength and function that we can have. So when we lose our curves, then we're not functioning at our best and we're likely to have an injury, okay? So when we do all of our exercises for our trunk and our legs and even in our normal daily activities, we need to make sure that our spine stays in those curves that they're designed to be in and we don't lose those curves, okay? So what I'm going to do is I'm going to have you bend your knees, put your feet flat, and I'm going to show you what neutral spine is. Now, are you relaxed? Okay, the position that your body is in right now, your lower back, I want you to crawl inside your body and feel what it feels like inside that lower back. You have a normal inward curve in your low back here. Okay, just relax. Can you feel my hand here? And you feel how your spine kind of curves in there? It's up, and it goes the opposite way in your middle spine, and then you have your inward curve in your lumbar spine. So, cervical. Inward curve, outward curve, lumbar, inward curve. So it's like an S almost. Okay? So when we do these exercises, the goal is that you do not move those curves. They stay in their neutral spine position, especially this area. This is the area we're focusing on right now, okay? So I'm going to put my hand under here again, so if you could let me lift up just a little bit. Okay, now relax. Now, do you feel my fingers underneath your bones here, right here? Okay, I want you to press your bones down against my fingers and smash my fingers against the table. You feel how you tighten up in here when you do that? Okay, that's called a posterior pelvic tilt, and I don't want you to do that, okay? That's what I don't want you to do. Now, I want you to arch your back up away. Feel that, how it lifts up off the table? Okay, that's the opposite. That's an anterior pelvic tilt. Relax. I don't want you to do that either. I want you to just relax, okay? This spine, I want it to stay in the same position it's in right now at rest throughout all your activities, okay? So now what I want you to do is to tighten up. An abdominal brace is tightening up all the muscles all the way around. Like a drawstring you pull on pants, you're going to tighten up all the way around, but you don't want to feel your backbone move. Backbone has to be very, very still and stay in that position. So I'm going to have you make sure you keep breathing, and I'm going to have you count with me. And we're going to just tighten it up all the way around, not just pulling in your tummy, but all the way around. Tighten it up and make that belt smaller. And breathe and count 1, 2, 3, 4, 5, and release. Okay? Tighten the belt again, move all the way around without moving your spine. 1, count with me, 2, 3, 4, 5. Release. That's an abdominal brace, and what it's doing is it's maintaining your neutral spine position. That's the explanation. Okay? You don't have to use those exact words, but as long as you can convey that message that that's what you want them to be able to tense those muscles up all the way around without moving their spine from its normal resting position, then you've done your job. Okay, so neutral spine, and don't move, we're moving on now. Now we're going to go through the spinal stabilization exercise program, and we're going to start in supine, and I'm going to instruct you how to perform a low-level exercise and describe how to perform a higher level exercise. So let's